Hello everyone. Today I am going to talk about autism spectrum disorder. Autism spectrum disorder, also known as ASD, is a neurodevelopmental disorder. And before I get into the details, let me just say that there's tremendous variability among individuals with ASD, and the characteristics I'm going to describe are not universal. That said, there are social and behavioral deficits that comprise the symptom profile of somebody with ASD. The diagnostic criteria for ASD include 3 social impairments. One such impairment is in what's called social emotional reciprocity, which includes difficulties with conversation, a lack of sharing interests, a failure to initiate and respond to social interactions. Another symptom involves deficits in nonverbal communication, such as eye contact, facial expressions, and nonverbal communication in general. The third social impairment relates to relationships, specifically a lack of interest in peers, difficulties in imaginary play, and a failure to make friends or adjust one's behavior to fit the social context. As I mentioned, ASD is characterized by behavior deficits. And in order to receive the diagnosis, an individual needs to have 2 of the following 4 symptoms. One symptom is excessive, repetitive motor movements, object use, or speech. Another area is an insistence on sameness, inflexible routines, or ritualized behavior. A third area is abnormally intense interests or interests with an unusual focus. The fourth behavior symptom concerns a hyper or hypo sensitivity to sensory stimuli. Although the diagnostic symptoms of ASD are social and behavioral in nature, ASD is also characterized by language, intellectual, and motor deficits. So not necessarily everybody with ASD has these deficits, but somebody who has ASD is going to be more likely to have deficits in those areas. ASD has a genetic basis, and there's also an environmental influence. Research is being conducted now to try to identify what those environmental factors are. We do know that vaccines are not the environmental factor. There's been a lot of research that has shown that they do not contribute to the possible development of ASD. In most cases, the impact of ASD actually begins at birth or shortly thereafter. Symptoms might not really be noticeable though until a child turns 1, maybe 2 years old. There are instances where an individual may lose skills as symptoms become more apparent. Although ASD is not a degenerative disorder, and an individual typically learns throughout one's life. Across the globe, ASD prevalence is fairly consistent. About 15 years ago, it was believed around 1 in every 150 individuals had ASD. But now, the most current estimates are that it's 1 in 59. And that increase is not because more people actually have the disorder. It's actually because pediatricians have become more aware of it, and they notice it more readily. And also there's been a change in the diagnostic criteria themselves, which has allowed more people to receive that diagnosis. We also know that the disorder is much more common in boys than it is girls. About 4 times as many boys receive the diagnosis than girls. So that's a brief rundown of the disorder. I hope that you found this information helpful. If you would like to find out more information about related topics, please check out some of the other videos that we have on our site.